The delivery system will not be able to handle individual choice anymore. That'll be in 2014, my prediction. Will employers keep health plans? I think open enrollment has to start with that question, at least part of it, is will you even have them? I think you will in 2014. I think you'll be thinking about it by 2017. I'm not sure you will by 2020. Communication becomes critical. Employees are sort of interested in healthcare reform right now. They know it's out there. They know you're not going to drop plans, but the discussion will be heavy in the next year. And as that gets on CNN, and if it ever makes its way into Us Weekly, God help us. But that's where you start seeing these issues. Us Weekly drives my life, by the way. Something happens in Us Weekly, it's on the front cover, boy. I heard a lot about Prince William. Tony Parker's apparently being divorced. I know all this stuff. And I know OK Magazine is just bad. Apparently they make things up. That's my wife told me. Healthcare reform divided into two categories: self-funded plans and insured contracts. So this is important to understand. What you have is very different in healthcare reform guidance. Partially self-funded is probably insured. But that's where you're really looking at two different things. So if you're insured, make sure you focus on insured. If you focus on self-funded, I've run my first person out, so I'm pretty proud of myself. Definition of essential health benefits and preventive. That's where, again, where it's important. What's preventative mean? Does it mean a doctor says that I need this? Does it mean it's medically governed to a ratio? A lot of claims are going to be decided on the concept of preventative. Essential health benefits is where this is going. The core plan that you cover are small pieces, and that's really what I'm trying to conclude with this. And hopefully, after a lot of complicated information, you can follow. People are not going to mess with essential health benefits coverage. The question is, what does it mean? You will have that. You'll be covering ambulance services, emergency services, core plans. But you will not necessarily be covering broader things, and this landscape's not going to shift. Non-discrimination is an issue that matters to you. So just to close with on renewal rates, because I think it's important as we're in that season. I get this question a lot, and I don't think people understand it, so I'm going to start adding this in a little bit to presentations. What impacts your renewal when you get it, when you talk about healthcare reform? A fully insured plan is you're going to have your experience, particularly if you're a small employer, or what I call C-high. There's going to be carrier trend factors, which are this kind of list. So that's things from the carrier themselves. There's going to be retention and pooling options. Part of that, there's going to be government assessments, and there's going to be what we call insurance carrier manual rates. So when you talk about renewal, you're largely talking about all of these things, not just trend, which is what a lot of us hear from consultants and et cetera. Trend is 9 or 10%. Well, that's just one piece of the pie. You might end up 26. Why are you 26 and fall for trend? Because what often happens is business owner, somebody else hears trend's only 10. Or worse, my friend who owns this business only had a 4%. Why don't we? But these are all the things that impact it. You have to understand your health plan, truly understand. Why do I bring this up? I had a client recently, a fairly large one actually, who said, I really don't want much more than 9% increase this year. Broker came back at 8.9%. There is no way that that broker wasn't working to 9%. And you have to be very careful when you tell your consultants what's okay, because okay is 0. Or truthfully, okay is whatever it should be based on what we have. Not, I've budgeted in 5, 6, 8, 9%. So you just have to be mindful of understanding those rates. And that's going to help you understand healthcare reform and whether I have a plan, and understand what goes into all of that. So self-funded plans, it's actually a lot simpler because there's not much to it. You just have experience, you have your trend kind of cost factors, and you have whatever admin and stop-loss fees come in. So a self-funded plan is a lot easier because you're not dealing with all these insurance company rates. So how does healthcare reform impact your cost then for the year? It's not going to be huge, I don't think. The increased dependent age requirement has increased some of the costs. 100% of the preventive care requirement, a little. Unlimited lifetime maximum, and removal of annual limits has actually had a really minor impact. So what are we seeing? We're seeing anywhere from 1 to 5% so far. You may know better, but that's what I've seen from my clients, at least what they say. So when I say to my business owners or my budget, what has healthcare reform really done? Absent giving me a chance to see a great speaker confuse the heck out of me about the legislative and judicial process. It has also increased your costs 1 to 5%. It's supposed to lower them in the long term, but we heard that about HIPAA. That ain't happening. Depending on current plan design and eligibility rules, so things can't change. The median impact's about 1.5 to 3. So if you get an increase this year and you see 10, 11, 12%, it's probably 1.5 to 3% impacted by healthcare reform. Trend has been running, what, 9 or 10% I've seen?
Actually, it's up around 13.
13, so even higher than the last lately. So you're seeing, if you had a normal plan, you'd end up 15–16%, and that's just disgusting. I mean, it really is. Expect 2012 rates to be minimally impacted. Why? Because nothing's really going to change except for internal costs. You might see insurance pass on that cost, but it won't be because of trend. Future mandates on plan eligibility have an impact, so 2014 does. And the pricing of exchanges, we really don't know what's going to happen. That's probably the biggest driver on cost in the future. So why do I tell you this? As you're budgeting, forecasting, you're putting in for finance folks, you have to be considering probably a 1 to 3% impact this year, probably a very static impact, and trend somewhere around 12, 13, 14% for the next 2 years out. How to mitigate expenses, which is important to all of us. Analyze your insurance methods, think about it, understand what it means. Fully insured versus self-insured is always a good decision, even if you're small, you should at least think about it. Understand stop loss. Don't be afraid to lose grandfathering. Look at your contribution strategy, utilization, understand why your plans. I've had clients who have found out that they had a clinic just down the road, and people were just going there after work, which is driving the claims costs through the roof, rather than, and if they brought in a network that covered that clinic, they would have been a lot cheaper. So you have those things that exist. Negotiate everything. Again, Michael is the expert here, but carriers and administrators don't want to lose business right now. It's a huge issue. So it's a very, very soft time, in my opinion, to be really heavily negotiating with your carriers. They want to keep you. Capitalize on the life and disability market. I think it's very soft right now. It's probably the best ways to save costs if you have those lines. And if you work with the great people at Fulton or anybody else, put pressure to make sure that no stone's unturned. I see a lot of consultants out there who hear your 9–10%, they renew, they get a bid they think is okay, and they send it out. A very large construction company here the other day I was talking to explained to me, when we got our bid, they said, oh, this is really tight, it's like 20%. They forced the broker to go back, it became 16. They forced the broker to go back again, it became 14. Well, there's no way that the company should have had to tell the consultant 20% was not acceptable, go back. The consultant should have been there with, this is the best bid possible based on your experience. A lot of consultants just go get bids and then come back and say, is it okay? And you have to really force them to do it. And the L&D comment is just that you can use L&D and other lines sometimes to help fund where your costs go, and that's where you can drive costs down right now. I think even more than medical. 401k plans, I'm just going to leave you with this because it matters. There's 401k regs that came out on fiduciary definitions, fee disclosure, there's Roth conversions out there. 401k has been very quiet this year, and I expect it'll ramp back up in 2011 because when we have interim presidential cycles, 401k tends to be a very hot topic to regulate. So I do think you'll see more and more fee disclosure issues on the 401k side. So that's it. I do thank you for joining us. What I hope you took away from today, just to summarize for you, is you understand the judicial process. You understand it's not going to work, probably, and I don't think the Commerce Clause will be effective, but that's where all the eggs are to overturn it. The legislative process is going to be appropriations. I don't think you'll see any major changes. The executive process is going to be really about, do I get something through and funded, and I'm going to regulate, and the other side's going to run out the clock. And what's effective today, it's preventative, it's essential health benefits, and defining those is what's going to matter for you for the next 2 years. I hope you enjoyed it. I'm glad nobody fell asleep. I almost did when I put it down. I love the sound of my own voice. I could talk forever. If you have questions, I have a half hour to spend with you, and I'm happy to have you email me, ask a question, just reference who you are, and I'm happy to answer it. And Iris Tilly is my associate, knows a lot out there, and she's happy to answer your questions.